Hey, Alpha Nurses, I'm Licensure from AlphaNurseGuide.com. This is 50 practice NCLEX questions. Without the way, let's get started.
The nurse in the perioperative area is preparing a client for surgery and notices that the client looks sad. The client says, "I'm scared of having cancer. It's so horrible and I brought on myself. I should have quit smoking years ago." What would be the nurse's best response to the client? 1. It's okay to be scared. What is it about cancer that you're afraid of? 2. It's normal to be scared. I would be 2. We'll help you through it. 3. Don't be so hard on yourself. You don't know if your smoking caused a cancer. 4. Do you feel guilty because you smoked? The correct answer is 1. Acknowledging the basic feeling the client expresses fear and asking an open-ended question allows the client to explain any fears. The other options dismiss the client's feelings and may give false reassurance or label the client's feelings. The client should be encouraged to explore feelings about a cancer diagnosis. Following a thoracotomy, the client has severe pain. Which of the following strategies for pain management will be most effective for this client? 1. Repositioning the client immediately after administering pain medication. 2. Reassessing the client 30 minutes after administering pain medication. 3. Verbally reassuring the client after administering pain medication. 4. Readjusting the pain medication dosage as needed according to the client's condition. The correct answer is 2. It is essential that the nurse evaluate the effects of pain medication after the medication has had time to act. Reassessment is necessary to determine the effectiveness of the pain management plan. Although it is prudent to check for discomfort-related positioning when assessing the client's pain, repositioning the client immediately after administering pain medication is not necessary. Verbally reassuring the client after administering pain medication may be useful to help instill confidence in the treatment plan. However, it is not as important as evaluating the effectiveness of the medication. Readjusting the pain medication dosage as needed according to the client's condition is essential, but the effectiveness of the medication must be evaluated first. A client has a chest tube attached to a water seal drainage system, and the nurse notes that the fluid in the chest tube and in the water seal column has stopped fluctuating. The nurse should determine that 1. The lung has fully expanded. 2. The lung has collapsed. 3. The chest tube is in the pleural space. 4. The mediastinal space has decreased. The correct answer is 1. Cessation of fluid fluctuation in the tubing can mean one of several things. The lung has fully expanded and negative intrapleural pressure has been reestablished. The chest tube is occluded, or the chest tube is not in the pleural space. Fluid fluctuation occurs because, during inspiration, intrapleural pressure exceeds the negative pressure generated in the water seal system. Therefore, drainage moves toward the client. During expiration, the pleural pressure exceeds that generated in the water seal system, and fluid moves away from the client. When the lung is collapsed or the chest tube is in the pleural space, fluid fluctuation is likely to be noted. The chest tube is not inserted in the mediastinal space. A nurse should interpret which of the following as an early sign of a tension pneumothorax in a client with chest trauma? 1. Diminished bilateral breath sounds. 2. Muffled heart sounds. 3. Respiratory distress. 4. Tracheal deviation. The correct answer is 3. Respiratory distress or arrest is a universal finding of a tension pneumothorax. Unilateral, diminished, or absent breath sounds is a common finding. Tracheal deviation is an inconsistent and late finding. Muffled heart sounds are suggestive of pericardial tamponade. Which of the following findings would suggest pneumothorax in a trauma victim? 1. Pronounced crackles. 2. Inspiratory wheezing. 3. Dullness on percussion. 4. Absent breath sounds. The correct answer is 4. Pneumothorax means that the lung has collapsed and is not functioning. The nurse will hear no sounds of air movement on auscultation. Movement of air through mucus produces crackles. Wheezing occurs when airways become obstructed. Dullness on percussion indicates increased density of lung tissue, usually caused by accumulation of fluid. Before we move on to the next question, the NCLEX Mastery Bundle is available, It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. The physician has inserted a chest tube in a client with a pneumothorax. The nurse should evaluate the effectiveness of the chest tube. 1. For administration of oxygen. 2. To promote formation of lung scar tissue. 3. To insert antibiotics into the pleural space. 4. To remove air and fluid. The correct answer is 4. A chest tube is inserted to re-expand the lung and remove air and fluid. Oxygen is not administered through a chest tube. Chest tubes are not inserted to promote scar tissue formation. Antibiotics are not used to treat a pneumothorax. After teaching the parents of a child newly diagnosed with leukemia about the disease, which of the following descriptions given by the mother best indicates that she understands the nature of leukemia? 1. The disease is an infection resulting in increased white blood cell production. 2. The disease is a type of cancer characterized by an increase in immature white blood cells. 3. The disease is an inflammation associated with enlargement of the lymph nodes. 4. The disease is an allergic disorder involving increased circulating antibodies in the blood. The correct answer is 2. Leukemia is a neoplastic or cancerous disorder of blood-forming tissues that is characterized by a proliferation of immature white blood cells. Leukemia is not an infection, inflammation, or allergic disorder. After teaching a child with leukemia scheduled for a bone marrow aspiration about the procedure, the nurse determines that the teaching has been successful when the child identifies which of the following as the site for the aspiration. 1. Right lateral side of the right wrist. 2. Middle of the chest. 3. Distal end of the thigh. 4. Back of the hip bone. The correct answer is 4. Although bone marrow specimens may be obtained from various sites, the most commonly used site in children is the posterior iliac crest, the back of the hip bone. This area is close to the body's surface but removed from vital organs. The area is large, so specimens can easily be obtained. For infants, the proximal tibia and the posterior iliac crest are used. The middle of the chest or sternum is the usual site for bone marrow aspiration in an adult. The wrist, chest, and thigh are not sites from which to obtain bone marrow specimens. A nurse is teaching the family of an 8-year-old boy with acute lymphocytic leukemia about appropriate activities. Which of the following activities should the nurse recommend? 1. Homeschooling. 2. Restriction from participating in athletic activities. 3. Avoiding trips to the shopping mall. 4. Being treated as normal as much as possible. The correct answer is 4. Any child with a chronic illness should be treated as normally as possible. Unless the child has severe bone marrow depression, he should be allowed to go to school with others and can go to the mall. If the child is in remission, athletic activities are allowed. The nurse is preparing to administer furosemide, Lasix, to a 3-year-old with a heart defect. The nurse verifies the child's identity by checking the armband and 1. Asking the child to state her name. 2. Checking the room number. 3. Asking the child to tell her birth date. 4. Asking the parent the child's name. The correct answer is 4. Safety standards require the use of 2 identifiers prior to medication administration. A parent can be used as the second identifier. Many young children will only answer to a nickname that does not coincide with a medical identification band, or may answer to any name. It is common for children on a pediatric floor to go into each other's rooms. A small child may not know their birth date. The primary health care provider prescribes intermittent fetal heart rate monitoring for a 20-year-old obese prima gravida client at 40 weeks gestation in the first stage of labor. The nurse should monitor the client's fetal heart rate pattern at which of the following intervals? 1. Every 15 minutes during the latent phase. 2. Every 30 minutes during the active phase. 3. Every 60 minutes during the initial phase. 4. Every 2 hours during the transition phase. The correct answer is 2. Labor is categorized into 3 phases: latent, active, and transition. During the active stage of labor, intermittent fetal monitoring is performed every 30 minutes to detect changes in fetal heart rate, such as bradycardia, tachycardia, or decelerations. If complications develop, more frequent or continuous electronic fetal monitoring may be needed. During the latent phase, intermittent monitoring is usually performed every 2 hours because contractions during this time are usually less frequent. During the transition phase, intermittent monitoring is performed every 5 to 15 minutes because the client is getting closer to birth the baby. There is no initial phase of labor. The mother asked the nurse why her child's hemoglobin was normal at birth, but now the child has S hemoglobin. Which of the following responses by the nurse is appropriate? 1. The placenta bars passage of the hemoglobin S from the mother to the fetus. 2. The red bone marrow does not begin to produce hemoglobin S until several months after birth. 3. Antibodies transmitted from you to the fetus provide the newborn with temporary immunity. 4. The newborn has a high concentration of fetal hemoglobin in the blood for some time after birth. The correct answer is 4. Sickle cell disease is an inherited disease that is present at birth. However, 60% to 80% of a newborn's hemoglobin is fetal hemoglobin, which has a structure different from that of hemoglobin S or hemoglobin A. Sickle cell symptoms usually occur about 4 months after birth, when hemoglobin S begins to replace the fetal hemoglobin. The gene for sickle cell disease is transmitted at the time of conception, not passed to the placenta. Some hemoglobin S is produced by the fetus near term. The fetus produces all its own hemoglobin from the earliest production in the first trimester. Passive immunity conferred by maternal antibodies is not related to sickle cell disease, but this transmission of antibodies is important to protect the infant from various infections during early infancy. The nurse notices that a client who has just given birth is short of breath, ashen in color, and begins to cough. She becomes limp on the birthing table. At last assessment half hour ago, her temperature was 98 degrees Fahrenheit, pulse 78 beats per minute, respiration 16 breaths per minute. Determine the nursing actions in the order they should occur. 1. Open airway using head, tilt chin lift. 2. Ask staff to activate emergency response system. 3. Establish unresponsiveness. 4. Give 2 breaths. 5. Begin compressions. The correct order is 3, 2, 5, 1, and 4. The client's actions indicate distress, and the nurse should initiate emergency procedures. The nurse should first establish unresponsiveness and then ask staff to activate the emergency response system. Next, the nurse should follow CABs of CPR. The nurse should check the pulse and begin CPR. Then after 30 compressions, the nurse should assure the open airway and give 2 breaths. A primiparous client who has just given birth to a healthy term neonate after 12 hours of labor holds and looks at her neonate and begins to cry. The nurse interprets this behavior as a sign of which of the following? 1. Disappointment in the baby's gender. 2. Grief over the ending of the pregnancy. 3. A normal response to the birth. 4. Indication of postpartum blues. The correct answer is 3. Childbirth is a very emotional experience. An expression of happiness with tears is a normal reaction. Cultural factors, exhaustion, and anxieties over the new role can all affect maternal responses. So the nurse must be sensitive to clients' emotional expressions. There is no evidence to suggest that the mother is disappointed in the baby's gender, grieving over the end of pregnancy, or a candidate for postpartum blues. However, approximately 80% of postpartum clients experience transient postpartum blues several days after childbirth. The healthcare provider has determined that a preterm labor client at 34 weeks gestation has no fetal fibronectin present. Based on this finding, the nurse would anticipate that within the next week, 1. The client will develop preeclampsia. 2. The fetus will develop mature lungs. 3. The client will not develop preterm labor. 4. The fetus will not develop gestational diabetes. The correct answer is 3. The absence of fetal fibronectin in a vaginal swab between 22 and 37 weeks gestation indicates there is less than 1% risk of developing preterm labor in the next week. Fetal fibronectin is an extracellular protein normally found in fetal membranes and deciduous and has no correlation with preeclampsia, fetal lung maturation, or gestational diabetes. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. A client with pregnancy-induced hypertension is to receive magnesium sulfate to run at 3 grams per hour with normal saline to maintain the total IV rate at 125 milliliters per hour. The nurse giving end of shift report stated that the client's blood pressures have been elevated during the night. The oncoming nurse checked the client and found magnesium sulfate running at 2 grams per hour. Identify the nursing actions to be taken from first to last. 1. Notify the primary healthcare provider of the incident. 2. Assess the client's current status. 3. Correct the IV rates. 4. Initiate an incident report. The correct answer order is 3, 2, 1, and 4. The nurse should first change the IV magnesium sulfate and normal saline infusion rates, and then assess the current status of the client. The nurse should then notify the primary healthcare provider to explain the error and report the action taken. A medication error has occurred, and the nurse will need to initiate an incident report. To determine whether a prima gravida client in labor with a fetus in the left occipital anterior position is completely dilated, the nurse performs a vaginal examination. During the examination, the nurse should palpate which of the following cranial sutures: 1. Sagittal, 2. Lambdoidal, 3. Coronal, 4. Frontal. The correct answer is 1. The sagittal suture is the most readily felt during a vaginal examination. When the fetus is in the LOA position, the occiput faces the mother's left. The lambdoid suture is on the side of the skull. The coronal suture is a horizontal suture across the front portion of the fetal skull that forms the anterior fontanelle. It may be felt with a brow presentation. The frontal suture may be felt with a brow or face presentation. A prima gravida client at 36 weeks gestation with premature rupture of the membranes is to be discharged home on bed rest with follow-up by the home health nurse. After instruction about care while at home, which of the following client statements indicates effective teaching? 1. It is permissible to douche if the fluid irritates my vaginal area. 2. I can take either a tub bath or a shower when I feel like it. 3. I should limit my fluid intake to less than 1 quart daily. 4. I should contact the doctor if my temperature is 100.4 degrees Fahrenheit or higher. The correct answer is 4. Because of the client's increased risk for infection, successful teaching is indicated when the client states that she will contact the doctor if her temperature is 100.4 degrees Fahrenheit or greater. The client should be instructed to monitor her temperature twice daily. The client should refrain from douching and tub bathing, which can increase the potential for infection. Showering is permitted because water in the shower doesn't enter the vagina and increase the risk of infection. A fluid intake of at least 2 liters daily is recommended to prevent potential urinary tract infection. A client diagnosed with undifferentiated schizophrenia is being discharged on aripiprazole 5 milligrams every night. When developing the teaching plan about the most common adverse effects, which of the following should the nurse include? Select all that apply. 1. Headaches that will subside in a few weeks. 2. Transient mild anxiety. 3. Insomnia. 4. Torticollis. 5. Pill rolling movements. The correct answers are 1, 2, and 3. Headaches, transient anxiety, and insomnia are the most common adverse effects of aripiprazole. Torticollis and pill rolling are more common with the older antipsychotics. The nurse is caring for a prima gravida client in active labor who has had 2 fetal blood samplings to check for fetal hypoxia. The nurse determines that the fetus is showing signs of acidosis when the scalp blood pH is below which of the following? 1. 7.5, 2, 7.4, 3, 7.3, 4, 7.2. The correct answer is 4. If the fetus is hypoxic, the pH will fall below 7.2 and be indicative of fetal distress. This finding typically requires immediate vaginal or cesarean birth. A scalp pH reading of 7.21 to 7.25 should be repeated again in 30 minutes for assessment of hypoxia and acidosis. After teaching a diabetic prima gravida about symptoms of hyperglycemia and hypoglycemia, the nurse determines that the client understands the instruction when she says that hyperglycemia may be manifested by which of the following? 1. Dehydration. 2. Pallor. 3. Sweating. 4. Nervousness. The correct answer is 1. Dehydration, polyuria, fatigue, flushed hot skin, dry mouth, and drowsiness are manifestations of hyperglycemia. Hyperglycemia is a medical emergency and requires immediate action to prevent maternal and fetal mortality. Pallor, sweating, and nervousness are early signs of hypoglycemia, not hyperglycemia. A 22-year-old client is being admitted with a diagnosis of brief psychotic disorder. 2 weeks ago, his girlfriend broke off their engagement and canceled the wedding. Given the Diagnostic and Statistical Manual of Mental Disorders criteria for this disorder, the nurse should expect to find which data during the interview with the client? 1. Current treatment for pneumonia. 2. Regular use of alcohol or marijuana. 3. Evidence of delusions or hallucinations. 4. A history of chronic depression. The correct answer is 3. According to the criteria of the Diagnostic and Statistical Manual of Mental Disorders, a diagnosis of brief psychotic disorder is made when the client exhibits delusions, hallucinations, and disorganized speech or behaviors in the absence of a mood disorder, substance-induced disorder, or general medical condition. Transferred data for a client brought by ambulance to the hospital's psychiatric unit from a nursing home indicate that the client has become increasingly confused and disoriented. The client's behavior is found to be the result of cerebral arteriosclerosis. Which of the following behaviors of the nursing staff should positively influence the client's behavior? Select all that apply. 1. Limiting the client's choices. 2. Accepting the client as he is. 3. Allowing the client to do as he wishes. 4. Acting nonchalantly. 5. Explaining to the client what he needs to do step by step. The correct answers are 1, 2, and 5. Confused clients need fewer choices, acceptance as a person, and step-by-step directions. Allowing the client to do as he wishes can lead to substandard care and the risk of harm. Acting nonchalantly conveys a lack of caring. The nurse is caring for a client with a suspected diagnosis of hypercalcemia, which sign/symptom is an indication of this electrolyte imbalance. 1. Twitching. 2. Positive Trousseau sign. 3. Hyperactive bowel sounds. 4. Generalized muscle weakness. The correct answer is 4. Generalized muscle weakness is seen in clients with hypercalcemia. Twitching, positive Trousseau sign, and hyperactive bowel sounds are signs of hypocalcemia. A client is being discharged before complete stabilization of symptoms. When developing a discharge plan for this client, the nurse should ensure that the client will have 1. More medical consultations after discharge. 2. Monthly outpatient visits. 3. Many coordinated services. 4. A caring and supportive family. The correct answer is 3. Many coordinated services are needed, including medication management, more frequent outpatient visits, day treatment, or some combination of these, to decrease the risk of relapse, which is common among chronically ill clients. Medical consultations, if needed, would be included in the coordinated services provided. Chronically mentally ill clients who are discharged early before becoming truly stable typically require more than monthly outpatient visits because of the high risk of relapse. A caring and supportive family is ideal for all clients, but not always available. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguy.com. Back to the questions. A client with acute respiratory distress syndrome has fine crackles at lung bases, and the respirations are shallow at a rate of 28 breaths per minute. The client is restless and anxious. In addition to monitoring the arterial blood gas results, the nurse should do which of the following? Select all that apply. 1. Monitor serum creatinine and blood urea nitrogen levels. 2. Administer sedative. 3. Keep the head of the bed flat. 4. Administer humidified oxygen. 5. Auscultate the lungs. The correct answers are 1, 4, and 5. Acute respiratory distress syndrome may cause renal failure and superinfection, so the nurse should monitor urine output and urine chemistries. Treatment of hypoxemia can be complicated because changes in lung tissue leave less pulmonary tissue available for gas exchange, thereby causing inadequate perfusion. Humidified oxygen may be one means of promoting oxygenation. The client has crackles in the lung bases, so the nurse should continue to assess breath sounds. Sedatives should be used with caution in clients with ARDS. The nurse should try other measures to relieve the client's restlessness and anxiety. The head of the bed should be elevated to 30 degrees to promote chest expansion and prevent atelectasis. A client diagnosed with acute pancreatitis 5 days ago is experiencing respiratory distress. The nurse should report which of the following to the healthcare provider? 1. Arterial oxygen level of 46. 2. Respirations of 12. 3. Lack of adventitious lung sounds. 4. Oxygen saturation of 96% on room air. The correct answer is 1. Manifestations of adult respiratory distress syndrome secondary to acute pancreatitis include respiratory distress, tachypnea, dyspnea, fever, dry cough, fine crackles heard throughout lung fields, possible confusion and agitation, and hypoxemia with arterial oxygen level below 50. The nurse should report the arterial oxygen level of 46 to the healthcare provider. A respiratory rate of 12 is normal and not considered a sign of respiratory distress. Adventitious lung sounds, such as crackles, are typically found in clients with ARDS. Oxygen saturation of 96% is satisfactory and does not represent hypoxemia or low arterial oxygen saturation. Which of the following assessments is most appropriate for determining the correct placement of an endotracheal tube in a mechanically ventilated client? 1. Assessing the client's skin color. 2. Monitoring the respiratory rate. 3. Verifying the amount of cuff inflation. 4. Auscultating breath sounds bilaterally. The correct answer is 4. Auscultation for bilateral breath sounds is the most appropriate method for determining cuff placement. The nurse should also look for the symmetrical rise and fall of the chest and should note the location of the exit mark on the tube. Assessment of skin color, respiratory rate, and the amount of cuff inflation cannot validate the placement of the endotracheal tube. Which of the following is an expected outcome for a client with carbon dioxide poisoning? 1. A relatively matched ventilation to perfusion ratio. 2. A low ventilation to perfusion ratio. 3. A high ventilation to perfusion ratio. 4. An equal PaO2 and PaCO2 ratio. The correct answer is 1. In the normal lung, the volume of blood perfusing the lungs each minute is approximately equal to the amount of fresh gas that reaches the alveoli each minute. Blood gas analysis evaluates respiratory function. The level of dissolved oxygen should be greater than the level of dissolved carbon dioxide. The nurse is a member of a team that is planning a client-centered approach to care of clients with chronic obstructive pulmonary disease. Using the chronic care model, the team should focus on improving quality of care and delivery in which of the following areas? Select all that apply. 1. The community. 2. Clinical information systems. 3. Delivery system design. 4. Administrative leadership. 5. Emphasis on the acute care setting. The correct answers are 1, 2, and 3. The process of changing a healthcare system from an acute care model to a CCM uses continuous quality improvement methods. The goal of the CCM is to improve the health of chronically ill clients. The The CCM identifies 6 basic areas upon which healthcare organizations need to focus to improve quality of care and delivery: health systems, delivery system design, decision support, clinical information systems, self-management support, and the community. This system requires healthcare services that are client-centered and coordinated among members of the healthcare staff and client and the family. CCM does not focus on the administrative leadership or the care in the acute care setting alone. The parent of an infant with a cleft lip and palate asks the nurse when the infant's cleft palate will be repaired. The nurse responds by stating that the first repair of a cleft palate is usually done at which of the following times? 1. Before the eruption of teeth. 2. When the child weighs approximately 22 pounds. 3. Before the development of speech. 4. After the child learns to drink from a cup. The correct answer is 3. The optimal time for a cleft palate repair depends on many factors. However, it is best done before speech develops and the child learns faulty speech habits as a result of the defect, usually before 12 to 15 months of age. Tooth eruption usually begins at about 6 months of age. The child should weigh about 22 pounds at 6 months, but the important consideration is to schedule surgery before speech patterns begin to develop. An infant may learn to start drinking from a cup as early as 6 to 7 months of age, possibly up to the first birthday. Which of the following would indicate that an infant with a tracheoesophageal fistula needs suctioning? 1. Brassy cough. 2. Substernal retractions. 3. Decreased activity level. 4. Increased respiratory rate. The correct answer is 2, with a TF. Overflow of secretions into the larynx leads to laryngospasm. This obstruction to inspiration stimulates the strong contraction of accessory muscles of the thorax to assist the diaphragm in breathing. This produces substernal retractions. The laryngospasm that occurs with a TF resolves quickly when secretions are removed from the oropharynx area. A brassy cough is related to a relatively constant laryngeal narrowing, usually caused by edema. It is not an indication of the need to suction. A decreased activity level and an increased respiratory rate in an infant with a TF are usually the result of hypoxia, a relatively long-term and constant phenomenon in infants with a TF. Which of the following should the nurse assess in a newborn diagnosed with an anorectal malformation? Select all that apply. 1. Abdominal distension. 2. Loose stools. 3. Vomiting. 4. Meconium in the urine. 5. Meconium stools. The correct answers are 1, 3, and 4. Anorectal malformations present with lack of stool or evidence of meconium in the urine through a fistula. Meconium is not found in the stool. Because stool does not pass, abdominal distension and vomiting occur. A 4-week-old infant admitted with a diagnosis of hypertrophic pyloric stenosis presents with a history of vomiting. The nurse should anticipate that the infant's vomitus would contain gastric contents, and which of the following? 1. Bile and streaks of blood. 2. Mucus and bile. 3. Mucus and streaks of blood. 4. Stool and bile. The correct answer is 3. The vomitus of an infant with hypertrophic pyloric stenosis contains gastric contents, mucus, and streaks of blood. The vomitus does not contain bile or stool because the pyloric constriction is proximal to the ampulla of Fata. After surgery to correct pyloric stenosis, the nurse instructs the parents about the postoperative feeding schedule for their infant. The parents exhibit understanding of these instructions when they state that they can start feeding the child within which of the following time frames? 1. 6 hours. 2. 8 hours. 3. 10 hours. 4. 12 hours. The correct answer is 1. Clear liquids containing glucose and electrolytes are usually prescribed 4 to 6 hours after surgery. If vomiting does not occur, formula or breast milk then can be gradually substituted for clear liquids until the infant is taking normal feedings. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. A 14-year-old girl with sickle cell disease has her fourth hospitalization for sickle cell crisis. Her family is planning a ski vacation in the mountains. What should the nurse tell the parents? 1. Encourage them to go on the trip. 2. Go on the trip, but find a sitter for the 14-year-old. 3. Suggest the trip be postponed until next year. 4. Explain that the high altitude may cause a crisis. The correct answer is 4. High altitude causes deoxygenation, which might precipitate a crisis. In clients with sickle cell anemia, cells sickle when the client experiences any situation where increased demand for oxygen is needed, such as an infection or dehydration, or when low oxygen concentration is experienced, such as in high altitudes or deep-sea diving. Crises can commonly be prevented by maintaining hydration. It would be unsafe to encourage the family, or to say nothing about taking client to high-altitude areas, but giving the parents adequate information will allow them to make an appropriate decision. Postponing the trip or leaving the child at home does not address the immediate concern for the child's health. When preparing a multigravida client who has undergone evacuation of a hydatidiform mole for discharge, the nurse explains the need for follow-up care. The nurse determines that the client understands the instruction when she says that she is at risk for developing which of the following? 1. Ectopic pregnancy. 2. Choriocarcinoma. 3. Multifetal pregnancies. 4. Infertility. The correct answer is 2. A client who has had a hydatidiform mole removed should have regular checkups to rule out the presence of choriocarcinoma, which may complicate the client's clinical picture. The client's human chorionic gonadotropin levels are monitored for 1 year. During this time, she should be advised not to become pregnant because this would be reflected in rising human chorionic gonadotropin levels. Ectopic or multifetal pregnancy is not associated with hydatidiform mole. Women who have molar pregnancies have fertility rates similar to the general population. A primigravida client in the second stage of labor feels the urge to push. The client has had no analgesia or anesthesia. Anatomically, which of the following will be the best position for the client to assume? 1. Dorsal recumbent. 2. Lithotomy. 3. Hands and knees. 4. Squatting. The correct answer is 4. Anatomically, the best position for the client to assume is the squatting position because this enhances pelvic diameters and allows gravity to assist in the expulsion stage of labor. This position also provides for natural pressure anesthesia as the fetal presenting part presses on the stretched perineum. If the client is extremely fatigued from a lengthy labor process, she may prefer the dorsal recumbent position. However, this position is not considered the best position anatomically. The lithotomy position may be ineffective and uncomfortable for a client who is ready to push. The hands and knees position may help to alleviate some back pain. However, this position can cause discomfort to the arms and wrists and is tiring over a long period of time. A child with hemophilia presents with a burning sensation in the knee and reluctance to move the body part. The nurse collaborates with the care team to provide factor replacement and 1. Administer an aspirin-containing compound. 2. Institute rest ice compression and elevation. 3. Begin physical therapy with active range of motion. 4. Initiate skin traction. The correct answer is 2. The child is displaying symptoms of bleeding in the joint and factor replacement is indicated. The Rice method is used additionally as a supportive measure to help control the bleeding. Aspirin-containing compounds contribute to bleeding and should never be used to control pain. Physical therapy is instituted after the acute bleeding to prevent further damage. Orthopedic traction is considered in some rare cases during the rehabilitation phase, but not the acute phase. The nurse and a nursing assistant are caring for clients in a birthing center. Which of the following tasks should the nurse delegate to the nursing assistant? Select all that apply. 1. Removing a Foley catheter from a preeclamptic client. 2. Assisting an active labor client with breathing and relaxation. 3. Ambulating a post-cesarean client to the bathroom. 4. Calculating hourly IV totals for a preterm labor client. 5. Intake and output catheterization for culture and sensitivity. 6. Calling a report of normal findings to the healthcare provider. The correct answers are 2 and 3. The nursing assistant could assist the client with breathing and relaxation and ambulate the post-cesarean client to the bathroom. Removing a Foley catheter would also involve assessment of bladder status and totaling the intake and output and would be a nursing responsibility. Calculating the hourly IV totals for a preterm labor client would involve assessments that require nursing expertise. In and out catheterization, a sterile procedure, and calling reports to healthcare providers, which requires gathering and analysis of data, are responsibilities of the nurse. Assessment of a 15-year-old prima gravida client at term and active labor reveals cervical dilation at 7 centimeters with complete effacement. The nurse should assess the client for which of the following first? 1. Uterine inversion. 2. Cephalopelvic disproportion. 3. Rapid third stage of labor. 4. Decreased ability to push. The correct answer is 2. Adolescent pregnancy carries an increased risk of pregnancy-induced hypertension, iron deficiency anemia, and CPD. CPD is a concern because maturation of the skeletal bones is commonly not complete in adolescence. Adolescent labor does not differ from labor in the older woman if no CPD is present. A prolonged first stage of labor and poor fetal descent may indicate that CPD exists. Uterine inversion, a rapid third stage of labor, or decreased ability to push may occur regardless of the client's age. A multigravida client at 34 weeks gestation visits the hospital because she suspects that her water is broken after testing the leaking fluid with nitrazine paper. The nurse confirms that the client's membranes have ruptured when the paper turns which of the following colors? 1. Yellow, 2. Green, 3. Blue, 4. Red. The correct answer is 3. If the client's membranes have ruptured, the nitrazine paper will turn blue, an alkaline reaction. False positives may occur when the nitrazine paper is exposed to blood or semen. The definitive test for rupture of membranes is Fern testing, where amniotic fluid is allowed to dry on a slide and then viewed under a microscope. Dried amniotic fluid will form a Fern pattern. No other fluid forms this type of pattern, which action by the nurse is likely to increase the anxiety and suspiciousness of a client who is delusional. 1. Informing the client of schedule changes. 2. Whispering with others where the client can observe. 3. Telling the client gently that the nurse does not share the client's view. 4. Inviting the client to join in leisure activities. The correct answer is 2. Whispering and laughing with another person where the client can see or observe a nurse, but not hear the conversation, increases the client's anxiety and suspiciousness. Therefore, this action should be avoided. Informing the client of schedule changes. Telling the client gently that the nurse does not share the client's interpretation of an event, and inviting the client to participate in leisure activities help the client to decrease anxiety and suspiciousness and to focus on actual or realistic events. A prima gravida client whose cervix is 7 centimeters dilated with a fetus at 0 station and in a left occipital-posterior position requests pain relief for severe back pain. The nurse should 1. Provide firm pressure to the client's sacral area. 2. Prepare the client for a cesarean birth. 3. Prepare the client for a precipitate birth. 4. Maintain the client in a left sideline position. The correct answer is 1. The client who has back pain during labor experiences marked discomfort because the fetus is in an LOP position. This pain is much greater than when the fetus is in the anterior position because the fetal head impinges on the sacrum in the course of rotating to the anterior position. Application of firm pressure to the sacral area can help alleviate the pain. Problems of severe back pain during labor do not typically require a cesarean birth. The primary healthcare provider may elect to do an episiotomy, but it is not necessarily required. It is unlikely that a prima gravida client with a fetus in an LOP position will have a precipitous birth. Rather, labor is usually more prolonged. A hands and knees position, or a right sideline position, may help to rotate the fetal head and thus alleviate some of the back pain. The nurse explains the complications of pregnancy that occur with diabetes to a prima gravid client at 10 weeks gestation who has a 5-year history of insulin-dependent diabetes. Which of the following, if stated by the client as a complication, indicates the need for additional teaching? 1. Candida albicans infection. 2. Twin-to-twin transfer. 3. Polyhydramnios. 4. Preeclampsia. The correct answer is 2. Clients who are pregnant and have diabetes are not at greater risk for multi-fetal pregnancy and subsequent twin-to-twin transfer unless they have undergone fertility treatments. The pregnant diabetic client is at higher risk for complications such as infection, polyhydramnios, ketoacidosis, and preeclampsia compared with a pregnant non-diabetic client. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguy.com. Back to the questions. The mother of a client with chronic undifferentiated schizophrenia calls the visiting nurse in the outpatient clinic to report that her daughter has not answered the phone in 10 days. She was doing so well for months. I don't know what's wrong. I'm worried. Which of the following responses by the nurse is most appropriate? 1. Maybe she's just mad at you. Did you have an argument? 2. She may have stopped taking her medications. I'll check on her. 3. Don't worry about this. It happens sometimes. 4. Go over to her apartment and see what's going on. The correct answer is 2. Non-compliance with medications is common in the client with CUS. The nurse has the responsibility to assess this situation, asking the mother if they've argued or if the client is mad at the mother, or telling the mother to go over to the apartment and see what's going on places the blame and responsibility on the mother and therefore is inappropriate. Telling the mother not to worry ignores the seriousness of the client's symptoms. An elderly woman experiences short-term memory problems and occasional disorientation a few weeks after her husband's death. She also is not sleeping, has urinary frequency and burning, and sees rats in the kitchen. The home care nurse calls the woman's primary health care provider to discuss the client's situation and background, assess, and give recommendations. The nurse concludes that the woman, 1. is experiencing the onset of Alzheimer's disease. 2. is having trouble adjusting to living alone without her husband. 3. is having delayed grieving related to her Alzheimer's disease. 4. is experiencing delirium and a urinary tract infection. The correct answer is 4. Delirium is commonly due to a medical condition, such as a UTI in the elderly. Delirium often involves memory problems, disorientation, and hallucinations. It develops rather quickly. There is not enough data to suggest Alzheimer's disease, especially given the quick onset of symptoms. Delayed grieving and adjusting to being alone are unlikely to cause hallucinations. Which of the following anticoagulants would a nurse expect to administer when caring for a prima gravida client at 12 weeks gestation who has class 2 cardiac disease due to mitral valve stenosis? 1. Heparin. 2. Warfarin. 3. Enoxaparin. 4. Arteparin. The correct answer is 1. Although there is no completely safe anticoagulant therapy during pregnancy, heparin is typically the drug of choice. Warfarin, a pregnancy Category D drug, can cause fetal malformations. Enoxaparin is sometimes used, but clients are typically switched to heparin near labor because enoxaparin used along with spinal or epidural anesthesia presents an increased risk of bleeding in epidural or spinal space. Arteparin also can cause fetal malformations. A 25-year-old client diagnosed with chronic schizophrenia states, "I stopped my medications a week ago. I was just tired of not being able to drink with my friends. Besides, I feel fine without them." Which of the following responses by the nurse is most appropriate? 1. It's important for you to go back on your medicines. 2. I hear how difficult it must be to live with the changes caused by your illness. 3. You will have a talk to your doctor about stopping your medications. 4. Your buddies will understand that you can't drink anymore. The correct answer is 2. By acknowledging the difficulties of living with the illness, the nurse conveys empathy for the client's feelings and opens up the lines of communication. Although it is important for the client to maintain compliance with medication therapy, telling the client that it is important to start taking them again or to talk with the doctor about stopping the medications ignores the underlying feelings of the client's initial statements. Stating that the client's buddies will understand may or may not be true. Additionally, this statement ignores the underlying feelings. Which of the following should the nurse expect to include as a priority in the plan of care for a client with delirium based on the nurse's understanding about the disturbances in orientation associated with this disorder? 1. Identifying self and making sure that the nurse has the client's attention. 2. Eliminating the client's napping in the daytime as much as possible. 3. Engaging the client in reminiscing with relatives or visitors. 4. Avoiding arguing with a suspicious client about his perceptions of reality. The correct answer is 1. Identifying oneself and making sure that the nurse has the client's attention addresses the difficulties with focusing, orientation, and maintaining attention. Eliminating daytime napping is unrealistic until the cause of delirium is determined and the client's ability to focus and maintain attention improves. Engaging the client in reminiscing and avoiding arguing are also unrealistic at this time. You can get the NCLEX Mastery Bundle now. Link is in the description, or you can get it at alphanurseguy.com.